As Kentucky health leaders try to reduce the number of opioid overdoses in the state, they're looking for new ways to fight the battle. So now the University of Kentucky is training pharmacists how to prevent overdose deaths while also teaching the public about why overdoses happen. Miranda Combs has this story new at 6.
If you sort of open your eyes and look at me and say, leave me alone, then that's over-medication, and we need to monitor because that over-medication can progress to overdose.
This class is a sign of the times.
This was basically birthed out of a recognition that there's a problem, especially with drug abuse, particularly in our state.
Brooke Hudspeth is a Lexington pharmacist. She's learning how to get a program and protocol in place to dispense naloxone, or Narcan, a drug meant to reverse an opioid addiction to anyone that asks for it.
The difference here is that we're able to dispense this medication without a direct prescription per se.
If we don't do our part as healthcare professionals to decrease deaths from opioid overdoses in Kentucky, who's going to? We're going to go through each of these.
So Trish Freeman and her team at the University of Kentucky's Pharmacy School have been holding trainings around the state for pharmacists to get certifications to then start dispensing naloxone without individual prescriptions. This authority comes from the passage of Senate Bill 192.
Pharmacists really, I think, that are interested in doing this recognize the role that they can play in this public health crisis. I mean, we have a public health crisis in Kentucky related to opioid overdose.
Freeman says making naloxone more accessible to patients will give them a chance at recovery.
Addiction is a chronic disease. And if you believe addiction is a chronic disease, then we have to understand that people with chronic disease relapse.
There's all kinds of factors that come into it.
Upstairs from this classroom is an associate dean working to pinpoint the addiction disease.
So the whole brain kind of acts in concert to drugs of abuse.
Linda Dwowskin can break down the brain's functions, but she says it's impossible to isolate the cause of drug addiction.
It's complicated. It's not really, I can't really give you a simple answer. Some people will take a drug once and become addicted, and other people don't.
She says a person's chance of becoming addicted to certain drugs has to do with certain factors and how the brain reacts. Genetic factors can play a role, as well as mental issues. Depression and anxiety can all heighten abuse potential.
Realizing the factors that are involved can help you to protect yourself from being exposed to drugs of abuse.
And this group is working to make sure they can give those struggling another chance.
I think it demonstrates the pharmacist's willingness to assume this responsibility and their recognition that they can play a huge role in decreasing overdose deaths, because if someone's dead, we can't get them into treatment.
In Lexington, Miranda Combs, WKYT.
Dwowskin is currently working to develop a medication to treat those addicted to meth. Right now, there's no available treatment for that particular drug.